Namaskar. Namaskar, hello, good evening to one and all. Myself, Bhalchandra Joshi, Marketing Head with Burgeon Krista, makers of Enzoflam, Joseph CV, and Nodimox Plus. At the outset, I take this opportunity to welcome you to the second session of Denticare, that is International Certification Webinar on Modern Dentistry in association with ICDRO on the topic Piezosurgery, a boon for modern dentistry. As Indian tradition says, Atithi Devo Bhava, let me take this opportunity to welcome our guest, our main speaker, Dr. Angelo Cardarelli from San Raffaele University, Milan, Italy, who is also author of a book, Piezosurgery, Surgery for Impacted Teeth. And to moderate this session, I welcome Dr. Vijay Deshmukh sir, Director of ICDRO Dental Implant Institute. I'm sure this webinar is going to be a unique academic feast and will enrich our knowledge on piezosurgery. With close to 6,000 plus delegates already registered for this particular event, I wish this international certification webinar on modern dentistry a grand success. Now, let me introduce Dr. Vijay Deshmukh sir. Dr. Vijay Deshmukh sir, as I mentioned, is Director of ICDRO Dental Implant Institute, leading dental implantologist of India with more than 30 years of experience in dentistry. He is a gold medalist and winner of Sibagaigi Award in 1989, Dr. Guglani Award in 1991, Dr. Barucha Award twice in 1993 as well as 1994, Dr. Ratan Memorial Award and Times Health Icon Award in 2017. He is chairman of International Clinical Dental Research Organization, that is ICDRO. He is ex-professor and HOD, Dr. D.Y. Patil Dental College, Pimpri, Pune. So with this introduction, I hand over this session to Dr. Vijay Deshmukh. Thank you, sir.
Namaskar. Welcome all the delegates to this beautiful and very nice event, ICDRO LKM Webinar International Certification Program, this is the second lecture in this series. And congratulations all of you, you are 6,000 plus dentists pan-India attending this beautiful lecture. So I'm really happy to introduce my friend from Milan, Italy, Professor Dr. Angelo Cardarelli. Is born in Italy. Is graduated with Lode in dentistry and dental prosthetics at the University of L'Aquila in 2007. Specialization in oral surgery at the University of Rome in 2010. He is adjunct professor and tutor at the San Raffaele University of Milan. He is scientific advisor to the dental clinic at the University and San Raffaele in Milan. He works in Milan as well as he recently started his practice in Dubai. So all of you can see Dr. Angelo's page in Dubai. He has a beautiful practice in Dubai also, where he practices implantology, oral surgery, and prosthetics. He's authored a book on piezosurgery. I think the only book in the library you can find in multiple languages. I think 10 to 15 languages been transferred by book published by Quintessence. So the book is on piezosurgery of impacted teeth. He has authored many publications, speakers at national international congresses all over. He's member of San Raffaele Implant Cultural Association. He's member of Italian Academy of Osseointegration. So I am really proud to present to all of you Angelo. His simple and lucid way of presentation will definitely benefit you in the private practice. And he's a private practitioner, so you'll get the tips behind his clinical presentation. Most of his lectures are very clinically oriented, so we are going to enjoy the cases. And he has a huge experience into piezosurgery, and he lectures, travels, I think, 2 universities a month. I think I see him in Moscow, I see him in Rome, I see him in Dubai. So congratulations, Dr. Angelo, you are becoming a star in dentistry, and wish you best of luck for today's presentation. Over to Dr. Angelo.
Thank you very much, and I'm very glad to be here today. And I would like to thank the Denticare and all of you for having me today in order to introduce my experience about the use of the piezosurgery. And obviously, thank you, my dear friend, Dr. Vijay, for giving me this great opportunity. For me, it's always a great pleasure to have the possibility to share our experience about, for example, the use of the piezosurgery in the surgical procedure in extraction and implant placement in order to perform a minimal invasive approach. So now I need to share my screen. I need to become a host in order to share the screen, please. Okay. Okay. So today we will discuss about the use of the piezosurgery in the extraction procedure and also in other surgical approach, because I think it's very important to perform a minimal invasive procedure in our practice in order to reduce the invasivity and the mobility for our patients, especially in the patient with some systemic disease, in order to have a better results for our patient. So before we start, I'd like to introduce myself. I come from a small town in the south of Italy, Isernia, where I work in my private clinic. This is my clinic, and I have a dedicated operating room for oral and implant surgery, because I think it's very important to perform a nice approach, and it's very important to follow an ergonomical approach in our procedure. And also I spend some of my time in Milan as adjunct professor in the San Raffaele University and as oral surgeon in the same hospital, as you can see from this image. And actually, I'm very happy to introduce my new activity also in Dubai, in Dona Medical Clinic. So, as you can see from this emblematic picture, I love the surgical extraction. As you can see from this picture, for example, I removed more than 15 impacted the molar in only one day, using the piezosurgery procedure, using the minimal invasive approach in order to reduce the issue and the problems during and after the surgery. And I would like to introduce my book about the use of the piezosurgery in the treatment of impacted teeth. And actually, this book is available in English version, in Farsi version, in Russian version, and also it will be available very soon in Chinese version. So the question is it possible to perform a minimal invasive approach also in extraction surgery? And the answer is absolutely yes. As you can see from this very simple video regarding an easy case about the extraction of the lower third molar using the piezosurgery procedure. So we have the lower third molar, as you can see. I can use a dedicated insert with the piezosurgery device in order to perform, in this case, for example, a flapless ostectomy, because with the piezosurgery, we can perform a very selective cut in order to protect the soft tissue and in order to reduce the ostectomy. And reducing the ostectomy, I can obtain a better results and a better outcomes in terms of the healing and in terms of the pain reduction and edema reduction for our patient. This is a very easy case, but only in order to understand how we can use the piezosurgery device, for example, in extraction surgery. Because as you know, during the eruption of permanent dental elements, it's possible to have during this period some problems that can cause the inclusion of these dental elements. And according to the epidemiological study, the incidence of this inclusion is about 20% with the predilection for women. And absolutely, for sure, the most frequent impacted teeth are the lower third molars, followed by the upper third molars, upper canine, lower canine, and then other dental elements. And which are the factors that can cause the inclusion of these dental elements? So we can have local factor and systemic factors. For example, local factor, extraction of deciduous teeth, no arched space, ankylosis, alteration of the follicle. But don't forget, we can have also systemic factor like osteoporosis, dysplasia cleidoclinic, as you can see from this emblematic case regarding the young patient, 15 years old, in which you can see a very complex clinical situation. We have a persistence of deciduous teeth, we have a suprannumerary teeth, so we need to treat this patient with a multidisciplinary approach in order to remove the suprannumerary teeth, in order to remove the deciduous teeth, in order to keep the space in the both arches in order to place implants for the final prosthetic rehabilitation. And it's possible to understand better this clinical situation on the right on the CBCT reconstruction. So often in our practice, we need to perform and to follow a multidisciplinary approach. So why the use of the piezosurgery is very important and is very useful in the extraction of impacted third molar. If you pay attention to this image regarding the extraction of the lower third molar, using this piezo insert, and obviously we have a different shape according to the different clinical approach, we can perform a very micrometric bone section, as you can see from the image in the middle of this slide. So using this piezo device, using the saline irrigation, we can perform a very micrometric bone section. And this micrometric ostectomy is more than enough in order to remove this distal impacted third molar. And in this picture, you can understand the difference between the traditional approach on the left, using the standard bars, the standard straight and piece, and on the right, we have this new approach using the piezosurgery device. So as you can see on the left, we have a very huge ostectomy. Instead, on the right, we have a very minimal and micrometric bone section. And as you know, if I have the possibility to reduce this ostectomy, this invasivity, I can obtain a better results in terms of the healing, in terms of the pain, in terms of the edema by our patients, increasing also the compliance from our patients. It's very interesting, this point. For example, another case, and after that I will show better the use of a dedicated flaps design in the approach of the lower third molar. I use always the same flap, the triangular flap with one horizontal incision at the base of the papilla between the first and the second molar, and one vertical distal incision exactly like this, in order to see the crown, in order to perform the ostectomy. And as you can see, in this case, I need to remove the bone in order to see the crown, and I can do it using the piezo device. And after that, I can remove this impacted third molar. And it's very interesting to see the small ostectomy that I can have after the extraction, preserving the bone on the distal part of the second molar. And it's very important. This is the very conservative approach, because I need to maintain a good healing, I mean about the periodontal tissue around the second molar. So for this reason, I can perform a very minimal ostectomy using the piezo in order to remove this third molar. So we have different clinical case with the same approach. Another case regarding the treatment of the lower third molar. After the full thickness flap disconnection, because as you know, in the extraction, we will use always the full thickness flap, and using the retractors, it's very important, the use of a dedicated instruments. I can hold the soft tissue, I can protect the vessel and the nerves in the thickness of the soft tissue, and I can see better, I can have a better surgical view. And after that, using another tips, I can perform the micrometric ostectomy, and after that, this ostectomy is more than enough in order to remove this third molar. And as you can see, during this different clinical procedure, in different clinical cases, we have the same surgical view, the same scenario with the minimal bleeding. Why? Because using the piezosurgery and using the saline irrigation, through the cavitation effect, we can reduce also the bleeding during the surgical procedure. This is another advantage that we can have using the piezo device in order to reduce also the bleeding, in order to increase our surgical view. Same protocol. After tooth extraction, I can fill this residual cavity using the collagen like this, for the hemostatic reason, and in order to maintain the same plan for the suture, use only 3-4 single simple nodes in order to close this wound. And as you can see from the picture on the right, I never used the suture at the base of the papilla between the first and second molar, because it will be an amazing way in order to reduce the edema and the swelling the day after. And also, in some of my cases, I treat a very young patient. So I remove the germ, I remove the crown before the roots development. As you can see, in order to reduce the risk to injure the nerve during the development of the roots, and in order to reduce the invasivity. This is a 15-year-old patient in which I performed the germectomy. So, using the minimal flap procedure, I can see the bone, I can remove the bone in order to see the germ, and after that, I can remove the germ altogether with a minimal invasive procedure. And obviously, I can use the same approach, for example, if we have a huge follicular cyst and impacted third molar. And as you can see from this video, on the left, we have the traditional approach performed by the piezosurgery procedure on the left, and on the right, the ostectomy performed by piezo insert. As you know, on the left, we have a huge ostectomy. On the right, at the end of the surgical procedure, we will have a better result in terms of the ostectomy. Very micrometric bone section. And this is an amazing result. In order to reduce the pain, in order to increase the healing after the extraction. As I told before, sometimes I treat a very young patients in order to remove the germ using the same approach as you can see from this video. This is the triangular flap, one horizontal incision at the base of the papilla between the first and second molar. It's very important to use the retractors in the distal part in order to perform a very precise incision. Always, we need to perform the distal vestibular incision in order to protect the lingual part. After that, as you can see, we have the full thickness flap, and I can start using this insert like this in order to remove the bone like this under the use of the saline irrigation. Always, I need to use always the saline irrigation. Again, we have a very nice surgical view. After that, I can change also the insert using a different insert with this shape in order to continue, in order to perform a better ostectomy. As usual, we have a very minimal ostectomy. This is the different insert in order to continue this ostectomy in close contact with the germ, like this. And in the germectomy procedure, we need to cut the crown in different parts. So now it's possible to see the crown without the roots, because this is the germ, 15 years old. So I can remove the crown, but I need to cut the crown in different parts in order to reduce the dimension of the ostectomy. And this is another amazing thing. I can use also the piezosurgery in order to cut the crown, avoiding the use of the traditional parts. So with only one device, I can perform the ostectomy and I can cut the crown. This is amazing. Using a different program, obviously, using a different power and a different insert, as you can see. So after this crown section, we need to use a dedicated S-shaped luxator in order to cut the crown, like this. And then we can remove the distal part of the crown and then the mesial one, like this. But as usual, we have a very small cavity. No bleeding, using the cavitation effect. So now we have the bone in this part, is very important for the periodontal reason, and we can fill this cavity using the collagen sponge, like this, and then we can go ahead with the single simple nodes in order to close this wound. Like this. No bleeding, as usual. And then single simple nodes. In this case, I used the resorbable suture. As I told before, we have different inserts for the extraction, for the ostectomy, for the sinus lift procedure, for the implant, according different clinical approach. So we have the possibility to choose different inserts, different tips. For example, if we need to remove the bone like this, for example, in this case, I need to remove this bone on the vestibular part before the implant placement. And I can perform this bone section using this insert. And it's very interesting to see this image in order to understand the very high precision that I can have using this device. And again, with an important bleeding reduction. So we have a different application. For example, in case of the osteonecrosis area, as you can see from this image, in order to treat this issue, I need to remove the necrotic area in order to see the bleeding from the residual part of the bone in order to increase the healing of this area. So, for example, in this case, I used the piezosurgery in order to remove this necrotic area, and also using the cell irrigation and using the vibration, I can clean at the same time this area in order to reduce the bacteria, in order to reduce the infection. So we can have the many advantages. I mean, I can use the piezo in this case in order to remove the necrotic area and at the same time reducing the power and increasing the saline irrigation. I can clean. I perform the decontamination of this area using the ultrasound vibration. And as you can see, only 2 months later, we will have this amazing healing, this amazing result, also in this case. Sometimes, for example, we need to treat this lesion like as you can see from this picture, on the right side on the maxilla, we have this odontoma in close contact with the sinus. So I need to perform a very, very minimal invasive procedure, and I can use the same piezosurgery insert in order to remove this odontoma in close contact with the sinus, preserving the sinus membrane and preserving the soft tissue in the posterior side of the maxilla, where often we have not a good view. So we can manage better. I mean, we can reduce the risk to injury the soft tissue in the posterior side of the maxilla using the piezo device. And as I told before, it's very interesting to see this short video in order to understand the power that I can have using the piezosurgery. This is an hypernectomy performed in the young patient, and using this device, I can cut the crown with the easy and safe approach, avoiding the burns like this. And as usual, we have not bleeding. And using a dedicated S luxator, we can remove the crown, the distal part and the mesial part, according to the right protocol in order to treat the germ, in order to perform the germectomy in the young patient. So in this case, we have the crown without the roots. So we will remove the crown before the roots develop. And again, different clinical case, but the same surgical scenario. So the diagnosis before the surgical extraction is very important, because sometimes, as you can see from this case regarding the treatment of the vertical lower third molar, we have a very strange root shape. So in this case, I need to cut the roots, and using the piezosurgery insert in close contact with the roots, I can reduce the risk of the fracture of the apex. And obviously, I can use for the odontotomy from the root section, I can use also the buns, but I need to use a dedicated buns, the long sides, in order to perform a precise crown and the root section. And for this reason, in fellowship with the Italian company Butterfly, I make this surgical kit for the crown and the root section in order to perform a very precise section like this in different approach. For example, in order to treat this third molar in the distal position, and in order to reduce the ostectomy, I can remove the distal part of the crown, and after that, using the luxator in the between the distal part of the second molar and the mesial part of the third molar, I can remove this third molar without problem. But as I told before, it's very important to use a dedicated instruments and a dedicated light in order to increase our surgical view. So I need to have a dedicated instrument, as you can see, but it's very important to know and to perform a right ergonomical approach. So I use always 2 retractors in the vestibular side and 1 retractor on the lingual side with the tongue retractor in order to protect the tongue and the lingual side. Different type of periosteel, mold, preacher, 2 different sides of the surgical ultrasound, and it's very important to use the use of the retractors for the lower jaw and for the upper jaw with this S shape in order to increase the surgical view in the posterior side of the maxilla, and also the bite block, as you can see from the picture on the right. With the bite block, we can keep the mouth, the open of the mouth, also in the patient with a low compliance. In medical case, with the same approach, two retractors in the vestibular part in order to maintain, in order to hold the soft tissue, in order to protect the vessel and the nerve, and one retractor in the lingual side. The instrument for the suction, different type of luxator, straight luxator, angulated luxator, and S-shaped luxator, and also a dedicated luxator with a very small apex in order to remove the residual part of the roots in case of the fracture. And as you can see, it's very important to follow the correct use of these instruments, the angulated, the straight, and the S-shaped luxator in order to the horizontal impacted third molar after the crown section. And obviously, we need to have different types of forceps for the lower and for the upper jaw. And again, it's very important the correct use of this instrument. And I love this instrument, and you can find this instrument in my surgical kit that I did with Houston. This is a German company, and with this instrument, with this ergonomical shape, we can enter inside the alveolar cavity without. And this is the traditional instrument, the straightened piece, the turbine, different bars. For example, you can use the straightened piece and the ceramic bars for the ostectomy, but actually, as I told before, I use only one device, the piezo device, for the ostectomy and for the crown section. Because the crown section and the root section sometimes is mandatory, as you can see from this case in which we have the horizontal lower third molar and the mesial impacted third molar. So in this case, it's absolutely necessary to perform the crown section in the both third molars in order to remove this third molar, reducing the ostectomy. Because as you know, the anatomy of the third molar is much variable. So we can have different shape. As you can see from this image, three divergent shape in the upper jaw. So in this case, we need to reduce the risk of this apex. And I can do it using the piezo insert in close contact, following the roots, in order to reduce the fracture of the bone in the posterior side of the maxilla, I mean the tuberosity area, in order to reduce the fracture of the apex. Because as you know, during the surgical procedure and during especially the extraction procedure, we can have edema, pain, alteration of the sensitivity in case of the injury of the alveolar nerve. For example, we can have, using the traditional bars, the straightened piece, we can have some issue on the soft tissue, on the lips. We can have the fracture of the vestibular area, the fracture of the apex. And sometimes, as you can see from this very extreme case, during the extraction of the lower third molar, in this case of the left third molar, we can have the fracture of the mandible. And how I can avoid this problem? I can avoid this problem performing the ostectomy using the piezosurgery insert and performing the crown and the roots section in order to reduce the power that I need to use during the extraction. And reducing the power, I can reduce the risk of the fracture. So it's very important, this thing. And again, sometimes we can have this issue, this problem after the surgical procedure. So I need to manage this problem. We need to reduce the surgical time. We need to reduce the surgical trauma. I mean, we need to preserve the periosteum. We need to preserve the soft tissue, because only preserving the periosteum, the soft tissue, we can reduce the edema, the ecchymosis, as you can see from this picture. This is not a big problem after the surgery, but this is not a good result in terms of the clinical view after the surgical procedure. So we can manage this, reducing the invasivity, using the piezo insert, because with the piezo insert, we will have a selective cut in order to preserve the soft tissue. And sometimes, if we have a close contact between the roots, the alveolar canal, we can see this bleeding. This is typical and normal situation, clinical situation. For example, that you can see in this case, because we have a close contact between the roots and the alveolar canal, so after the extraction, we can have an important bleeding. So in this case, we need to inform the patient about the possibility to have the temporary alteration of the sensitivity. Because using the piezo, if I will touch with the insert the nerve, we will have not the interruption of this nerve. For example, if I will use the bands, especially if we have a close contact between the roots and the nerve, I will have the risk to cut the nerve. And as you can see from this epidemiological publication, the incidence of the alteration of the alveolar nerve is between, after 4 months, 0 and 0.2%. Instead, in the extraction of the lower third molar is very important to manage the lingual part, avoiding the injury of the lingual nerve, because as you can see, the incidence of the injury of the lingual, of the alteration of the lingual nerve after 6 months is between 0.5% to 20%. For this reason, we need to protect the lingual part. Also because in case of the injury of lingual nerve, we can have the alteration of the sensitivity, hypoesthesia, and the pain in some of these cases. So don't forget to protect always the lingual part, avoiding the use of the bands in order to cut the crown, using the piezosurgery device. And this is a pharmacological protocol in the case, just in case if we have the alteration of the sensitivity on the alveolar and the lingual nerve, we can prescribe the steroids and the acid lipoic and the vitamin B in order to increase the healing of the nerve and in order to reduce the pain for the patient. And we need to prescribe these drugs at least for 2 months. So using this device, we can treat also a very challenging case like this, in which we have an impacted premolar on the left side of the mandible in close contact with the mental nerve, but I can do it without problem using the piezo. So as usual, we need to check the emergence of the mental nerve, as you can see from the image on the left side, and using the pencil, I can mark the emergence of this nerve on the bone in order to see during the surgical procedure, in order to protect the nerve. After that, using the piezo, we can perform the ostectomy, because as you can see from the X-ray, from the CBCT, the premolar is on the top of the emergence of the mental nerve. So using the piezo, we can perform this ostectomy, this bone section, in order to see the crown, exactly like this, using a dedicated insert in order to perform this bone ostectomy. So we need to protect the mental nerve using the retractors, full thickness flap as usual, and also if I'll touch the nerve, we will have not problems in terms of the interruption of the nerve, the sensitivity of the nerve. So after that, we have this view. So as you can see now, it's possible to see the close contact between the crown and the mental nerve. In this case, we can use the piezo also to cut the crown, and after that, we can remove also the root, as you can see. And for example, in this case, it's mandatory to fill this residual gap using the bovine bone in order to maintain the volume. And after that, we can perform the suture. So as I told before, in the approach of the lower third molar, don't forget that we have the facial artery in the thickness of the cheek and the lingual nerve on the lingual side. For this reason, we need to use always this flap, one horizontal incision and one vestibular distal incision, exactly like this. Because in 86% of our patients, the nerve goes on the superficial part. So it's very difficult to manage this clinical case, because in 14% of our cases, the nerve goes in the superficial part, but likely in 86% we have this favorable situation, so the nerve goes in close contact with the lingual part. And as you can see from this cadaver dissection, if we need to disconnect also the soft tissue in the lingual side, we can do it with the full thickness flap, protecting the nerve using the periosteel. And after that, after this protection performed by the periosteel using the full thickness flap, we can go ahead for the crown section procedure, for example. But I suggest you the use of the piezo in order to reduce the risk. And this is the triangular flap, the lateral and the occlusal view, and this is the flaps disconnection. The same flap that we can use, for example, in the upper jaw, one horizontal and one vertical incision, as you can see from this case regarding the treatment of the lower third molar. So one vertical distal incision and one horizontal distal incision at the base of papilla between the first and the second molar. And after that, minimal flap, minimal ostectomy performed by the piezo. And in this case, I need to remove the distal part of the crown, and after that, using the luxator, the straight luxator on the mesial part, I can remove with distal movement this third molar without problem. And the same protocol, collagen, suture, same protocol. And now I want to share this surgical procedure about the use of the piezo in the lower third molar in order to resume this surgical approach. Again, the retractors in order to hold the soft tissue, the tongue retractor on the lingual side. It's very important to hold the soft tissue on the distal part in order to perform a very precise incision with the blade 15C. I use always the 15C. After that, we have this surgical view. So I will use two retractors, one in anterior and one in the posterior side, and now it's possible to see the crown. So now I can use directly the piezo insert in order to perform this ostectomy, and using the piezo, I can perform a deeper ostectomy. So I can perform an ostectomy in close contact between the roots and the bone, exactly like this, reducing the bone section. So now this ostectomy is more than enough in order to remove this third molar. But obviously I need, according to the X-ray pre-op, I need to cut the crown and the roots using these bands like this. And after that, using the S-shaped luxator, I can remove the distal part like this, using the angulated luxator, exactly like this. And this is the new forceps that you can find in my surgical kit with this amazing ergonomical shape. And then using the straight luxator here, we can remove the mesial part with distal movement without problems in terms of the injury of the soft tissue and the nerve. And it's very interesting to see the view after the extraction, because in this case, we have a bone septum between the roots. So in this case, it's mandatory to perform the coronectomy and the roots section. As usual, the collagen inside and the simple nodes in order to close the cavity. And the suture, minimal invasive. Sometimes we need to treat a very challenging case like this, young patient in which we have this central incisor in a very strange position, and we have the Maryland temporary crown on the central incisor on the right side. So we need to treat this patient in order to place the implants in the anterior part. So I can remove this central incisor using the piezo approach. I need to fill this cavity using the bovine bone, covering this grafting material using the collagen membrane, and after that we can perform the interrupted sutures. This is the healing few weeks later with the minimal invasive approach. So using these ultrasound waves, we can have a micrometric cut, a selective cut, and we can reduce the bleeding using the microvibration, the cavitation effect, and the hammering action. So using the micrometric cut, we can perform a very, very precise bone section. And we can work also in the surgical site with an high risk, like sinus membrane, like vessel and the nerve. And also using two different types of the ultrasound waves, we can clean continually the insert surface by the bone chips in order to reduce the risk of the necrosis related to the temperature increasement. And we can treat all cases like this, young patient in which I need to remove the third molar and I need to recover the second molar like this in only one stage. And it's very interesting to see this bone section performed by the piezo. Sometimes during the extraction, as you can see from the CBCT, we can have the fracture of the apex, especially in the case like this, in which the apex is in close contact with the nerve. Using the piezo, we can remove this apex also in this case, in which we have a close contact, as you can see from the CBCT below, using a dedicated insert without problem in terms of the injury. Sometimes we need to treat the impacted canine on the palate area. And this is a very interesting case in which in both sides of the maxilla, we have this canine in close, the apex of this canine in close contact with the sinus, right and the left side. This is the occlusal view. I performed the full thickness flap, the envelope flap, and using the piezo, this insert, we can remove the bone, we can see the crown, we can cut the crown, the roots, in order to remove both canine with the minimal invasive approach and procedure. And after that, we can fill the gap the cavity using the collagen, we can close the wounds using the interrupted sutures. And again, if we need to treat the huge cyst in the mandible in close contact with the mental nerve, we can do it using the same piezo insert approach technique, performing the bone broad section, removing and performing the sutures. And it's very interesting to see this histological result. We have the same clinical case, the same clinical site in which we have performed two different techniques. Here, it's possible to see the ostectomy performed using the straightened piece. And on the right, we have the histological result. And as you can see, we have a very important necrosis area along the bone section. Instead, using in the same clinical site, the different approach, the piezo approach, we will have a different and a better result in terms of the osteonecrosis reduction. It's very interesting to see this result. And again, different histological result using the piezo and using the straightened piece. And again, on the left, the ostectomy performed by the straightened piece and the histological result with a necrosis area along this section, bone section, and on the right, the ostectomy performed by the piezo. Better result and less necrosis. So we have many publications about the use of the piezo. So using the piezo, we can reduce the pain, the trisma, the edema, we can increase the healing. And using a dedicated device, we can have the same surgical time. For this reason, we need to choose a dedicated piezo device with a sufficient power in order to have the same surgical time that we can have using the traditional bars. And as I told before, we have different tips. This is my kit for the extraction, in which you can find different inserts for the extraction. This is the kit made for the extraction. We have all inserts dedicated for the extraction. For example, for the upper jaw, for the germectomy, for the coronectomy, a dedicated instrument with this shape in order to remove, for example, using the vibration, the big lesion on the palate. And basically, I use this instrument. We can use the diamond, this sharp insert shape in order to remove the bone in the posterior side of the mandible. And this very interesting insert, with this insert we can perform the ostectomy and we can collect at the same time the bone chips in order to fill, for example, the residual cavity after the extraction. Diamond shape again. I love this insert. And we can use also in the orthodontic approach in order to perform the orthodontic traction like this, using the piezo insert. And preparing the way in order to use the traction inside the cavity. Very interesting to listen to the sound of this piezo. Need to use with under navigation always. And after that, we can perform the orthodontic traction. So through this drawing, it's possible to understand the use of the piezo insert in close contact between the bone and the root. And after that, we can remove this dental element without problem. So we have many applications of this device. Also, for example, in endodontic surgery, like this. In this case, we need to keep this canine. So But as you can see from the X-ray, we have a periapical lesion on the apex of the canine on the right. So we need to perform the endodontic surgery in order to keep this canine, and that we can use the piezo also in this case. This is the lesion. So we can use the diamond insert in order to perform the ostectomy like this. The apex, and according to the endodontic procedure, we need to cut at least 2 millimeters of the apex, exactly like this. This is the apex after the section. And now under microscopic view, we can see the apex, and we need to prepare the apex using another type of the piezo insert, like this. In order to prepare the apex, in order to remove the guttapercha like this, this is the microscopic view. We can treat the apex with the acid. And then we can wash using the irrigation. And we can close the apex using the MTA with the light. And then we can remove the residual part of this material like this. And then we can put inside the collagen. We can check using the mirror. And I fill it using the collagen because this is a space-making defect. And then we can close using the interrupted sutures and the resorbable sutures 5-0. Like this, the X-ray and sutures. So this is another application, again, another apicectomy. This is the correct approach using the piezo, using the endodontic insert. And also another application is in the orthodontic recovery procedure. As you can see from this clinical case regarding the young patient in which we have a deciduous teeth, so we need to remove this deciduous teeth, and then we can perform the orthodontic recovery. This is the semilunar flap, and using the diamond piezo insert, we can perform the small ostectomy in order to see the crown of this canine. Obviously, we need to see the CBCT in order to understand the correct position of this canine, vestibular or palatal site. Obviously, in this case, my approach, it will be palatal, it will be vestibular approach, considering the position of the crown that I saw on the CBCT before. And in fact, as you can see, it's possible to see the crown of the canine like this. The same procedure using the acid in order to treat the crown. I need to dry the crown. And then we can fix the orthodontic bracket. Like this. And we can use the intra-alveolar cavity in order to perform the traction using the straight wire inside the alveolar cavity, exactly like this. And then we can close the wound using the sutures as usual. The X-ray post-op. And then the sutures. So this is another application. Sometimes we need to treat this challenging case, in both sides, right, left, second, and third molar, but we can perform the same minimal invasive approach. Also in this case, the intraoral view, so there is the indication for the extraction. On the right side, I performed the same flap and I removed the third and the second molar like this, using the same flap and the same procedure. And the same approach on the left side. Is very interesting to see the shape of this root of the second molar in close contact with the alveolar nerve. And this is the healing 1 year later, using the piezo procedure. Again, another interesting case in which we have in old patient a huge follicular cyst on the right side. And it's very interesting to see the dimension of this lesion from this BCT. Performing the same approach, we can see this big lesion and I can use the syringe in order to reduce the volume of this lesion. After that, using the piezo, we can cut the crown and we can remove altogether this lesion. And it's very interesting to see the lingual bone attached on the lingual part of the root. And I filled this gap using the collagen and using the horizontal mattress, in this case, not interrupted sutures, but in the horizontal mattress in order to avoid that the soft tissue goes inside the residual cavity. And again, the healing only 1 year later. Another interesting case, very challenging case. This surgery in general anesthesia using the bone blown section performed by the piezo and fixing the bone block using the titanium plaque like this. Also in the palatal side, we can use the piezo in order to remove the lesion like this. And this is a short video about this procedure. This is the CBCT before, so it's possible to see the lesion on the palatal side. I performed the envelope flap as usual, without vertical incision, with full thickness flap. And I use always the sutures in order to hold this soft tissue, in order to check the emergence of the nasopalatal canal. Using the diamond insert, we can remove the bone like this. We can check the lesion and we can increase the dimension of the ostectomy, working in close contact with the soft tissue without problem. Because as I told before, we can touch the soft tissue with the piezo without issues. We can remove the lesion. And then we can fill the gap using the collagen. We can clean using cell irrigation. We can close the wound using the suture. Interrupted suture, same protocol. Like this. Easy and safe procedure. Also, in the treatment of the upper third molar, we don't forget to use a dedicated instruments in order to avoid the fracture of the tuberosity. So also in this case, we can use the piezo approach like this, where this impacted after the molar. So using this instrument, we can perform the osteectomy like this. In order to avoid the risk to dislocate the third molar inside the sinus. So after this osteectomy, using the straight luxator like this, and distal movement, we can remove the third molar. Exactly like this.
Via l'aspiratore.
Using the angulated luxator and a dedicated forceps for after third molar, like this. And that's it. So it's very important to follow this movement in the extraction of the upper third molar. Sometimes we need to cut the crown, as you can see from this case. And it's a very challenging case in which I removed the second molar in very strange position in the right side of the maxilla. This is the CBCT. And the position of this second molar in close contact with the sinus also. So I performed the triangular flap with one vertical mesial incision like this, in order to see the zygomatic area also. And this is the position of this second molar. So we can perform the osteectomy using the piezo, and we can see the crown and the roots. And after that, obviously, we need to cut the roots in order to remove this impacted second molar. This is the position of this second molar. Very, very interesting case, considering the strange position of this second molar. After the section, we can remove the roots using the straight luxator like this. And then the crown. Okay. Preserving the integrity of the sinus membrane. And at this time, I will keep this third molar in order to guide the self-regeneration inside. I will remove the third molar after 6 months later. And then I performed the interrupted suture. So at the end of this short lecture, if you have any question, please feel free. Thanks again for your kind attention. And if you have the possibility and if you want to have more details about this procedure, you can find more details in this book regarding the piezosurgery treatment of impacted teeth. So thank you again for your kind attention.
A very nice presentation, Dr. Angelo, and I'm sure now the only address in Dubai for removal of the wisdom tooth will be Dr. Angelo's Roma Clinic.
Thank you.
So we have a lot of friends in Dubai, and definitely they would be referring their cases to your clinic in Dubai.
Thank you.
There are many questions from the audience, but I think your presentation was so nice. I think most of the questions are answered, but there are a couple of questions I will take. Which company do you feel is the best in piezo motors? Because a lot of people would like to have the first-hand information because you used a couple of products, and what is the best company you recommend?
Yes. In the past, for 10, 12 years, I used the Mectron device. The Mectron device, Mectron is a very nice device. Yes. But actually, in the last 2 years, I introduced a new device with high power called Esacron. This is an Italian brand. You can perform and you can have a better result because we have a much power in comparison with the Mectron. So basically, we can use Mectron and Esacron, but actually I use Esacron.
Right. So hope that this will be available in India soon at an economical cost, because Indian dentistry is is 5 times less cost effective to the rates of European practice. So we look for equipments which are within the affordable range. So if you are looking for a distributor, that would be my recommendation, that they could launch around 2.5 lakh rupees or so. What are the advantages of piezoelectric tips over the saw? Is a question asked by Dr. Simran Parwani from Amravati. Advantages of piezoelectric over the saw. Actually, now saw we don't use. Cutting saw.
I don't understand cutting.
Yeah, in the beginning, oral surgeons used to use a saw, and now we don't use saw. We use either burr or we go for piezoelectric. It's an old question, so we'll go for the next question. Saw, cutting saw.
Okay.
What is the cost of piezoelectric tip? Is a question.
The cost is the average is in euro 100-120 euro.
Okay. And do they break during the procedure?
Sorry?
The tip breaks sometimes?
Yes.
Okay. The question is that what is the importance of piezoelectric in endodontics? Can we use in endodontics?
Yes, you can use in endodontic surgery in order to remove the apex, not to prepare the canal, the root canal, but for the endodontic surgery, you can use the piezo in order to remove the apex.
Any instrument inside the canal can be removed? I don't think so.
No, not to prepare the canal, only to prepare the apex after the apex section, only for the endodontic surgery.
Correct. The question is again, use of piezosurgery in ridge split. Splitting the ridge.
Absolutely. This is another use of the piezosurgery because we have a dedicated insert in order to split the crest, and also we have a dedicated insert to prepare the implant site, avoiding the burns, using only the piezo insert.
One question is there, can piezosurgery be used in old age patients? Old patient?
Absolutely, with an amazing advantage because we can reduce the invasivity, we can reduce the bleeding. There is a good indication for all the patients, absolutely.
One question by Dr. Shobha, she asks, is there any frequency difference for maxilla and mandible? Is the frequency
Yes,
of
yes, we can, using the Mectron, for example, you have a dedicated program and you can't change the power and the vibration. Using the hexachrom, you can change the ultrasound waves and you can change the power. Obviously, if you need to cut the crown, you need to increase the power, reducing vibration. If, for example, you need to perform the split crest, you need to reduce the power and you need to increase the vibration, obviously.
And the last question by Dr. Riyaz Khan is a general question. What is the success of dental implants in periodontal disease? General question.
Yes, general question. You can place the implant in the patient with periodontal disease, but it's very important to manage this disease before the implant placement. Sometimes it's necessary to remove all residual dental elements in order to reduce the bacteria inside the oral cavity. So basically, you can treat this patient with implant placement, but it's very important to check and to manage in order to maintain the same control of this periodontal disease before the implant placement.
Thank you, Dr. Angelo. Over to Dr. Balchandra for concluding session. It's a nice presentation, Dr. Angelo. Congratulations.
Thank you. Thank you.
Thank you, sir. Hello and good evening to one and all. Myself, Bhalchandra Joshi from Dentistry. At the outset, I take this opportunity to thank Dr. Angelo, sir, for taking out his precious time and sharing his expertise on Piezosurgery. I'm sure all the delegates have learned many takeaways from your session, and you truly enriched all our delegates with some key insights on Piezosurgery, demonstrated with so many cases, which will be of immense use to Indian dental fraternity. My sincere thanks to Dr. Vijay Deshmukh, sir, Director, ICDRO, for his excellent moderation and clearing all the doubts of the audiences. Also, thanks to all the delegates. With over 6,400 registrations, your presence made this Expo Talk a great success. I hope you have downloaded your certificate for the first module, and our first module on sinus perforation is still live on the same link. Certificate for module 2 would be live on Monday, so please do download your certificate for all the delegates. Your valuable prescription support for Enzoflam, Joseph CV, and Nodimox Plus will be always encouraging to all of us. Thank you very much and have a pleasant evening. Thank you.
Thank you.
Thank you very much.
Thank you,
everyone.
Take care. Thank you, Angelo. Bye-bye.
Take care.
So, Anil, is it off now?